So, if someone's down in this low importance, low confidence box, the first thing that you can try to do as their therapist is gather information on why it's not important to them. It might be it's not important to them because they don't believe about that they're going to change or there's confidence there. You can educate them on mental health, educate them on the therapy that you offer, and things like the need to be engaged, the need to do homework, things like that would come into this box. You can also signpost if appropriate. If, for example, someone says, well, I would like to do therapy, but just now's not a really good time for me. It might be that actually now it might be better off to signpost them to some kind of self-help, and maybe they come back in the future when they can prioritize your work. Around the confidence side, you can get them to reflect on that, challenge it, play devil's advocate. If they say, well, I've been depressed for 20 years, so I don't think things are going to change, challenge that. We know that regardless of how long someone's been experiencing a mental health issue, there's evidence that different types of therapies can help them. So challenge it, normalize these fears. For your patients in your low importance, high confidence group, again, gather information on why it's not important to them, do the education stuff, signpost if they don't want to prioritize it or work with you. If their confidence is high, you can kind of gather information on that dissonance. So if they really do think that things could change, why is it that now's not a good time for them? Why is it that they don't want to or it's not important to them? For your high importance, low confidence, positively reinforce that they've come forward for support. So they've said that it is important for them and they want to prioritize that. We want to positively reinforce that, really important. And then, as we did with the low importance, low confidence, we want to try and play devil's advocate and challenge these feelings of low confidence. Normalize the fact that when someone comes into therapy, it's normal for them to feel that way. And actually, we can build that up through our sessions. And then lastly, when your patients are, or if they come to your sessions in that high importance, high confidence group, so like we said, they want therapy and they think it's going to work for them, load of positive reinforcement. It's great they come to you. It's great they're so engaged. And you can start to be collaborative. So starting to give someone more of the control of the sessions over them. They think it's going to work for them. They want it to work. Let's give them choice over what treatments they have. Let's give them choice over homework. So why I'm showing you this is just a brief overview of the motivational interviewing. Is that, again, you can start to think if you're noticing time boundary issues with your patients or you're noticing any engagement or motivation issue, try and think about where the patient is in that box. And then based on where they fall, try these tips out. See if you can push that patient more towards the high importance, high confidence group.